In this presentation for nursing students, we will explore osteogenesis imperfecta, OI, a genetic disorder characterized by brittle bones and an increased susceptibility to fractures. OI is primarily caused by mutations in the COL1A1 or COL1A2 genes, leading to impaired collagen production. The genetic basis of OI follows an autosomal dominant inheritance pattern, although sporadic cases also occur. Clinical manifestations of OI include frequent fractures, blue sclerae, and potential hearing loss. The severity and types of OI can vary, categorized from type 1 to type 4. Diagnosis involves genetic testing to identify mutations in the implicated genes, complemented by imaging studies like X-rays and bone density scans to assess bone fragility. Treatment options for OI encompass pharmacological interventions, notably bisphosphonates to enhance bone density. Surgical interventions, such as rod placements, may be considered for severe cases. Physical therapy and the use of assistive devices play crucial roles in managing OI. Nursing management in OI is multifaceted, involving collaboration with a multidisciplinary team for comprehensive patient support. Nurses play a pivotal role in medication management, administering medications, monitoring for side effects, and educating patients and families. Recognizing and reporting adverse reactions is paramount. Supportive care measures include fall prevention strategies, patient education on self-care, and emotional support for coping with the impact of OI. Holistic nursing care for OI emphasizes individualized care plans that consider the physical, emotional, and social aspects of the patient's experience. This involves facilitating communication and collaboration within the healthcare team and educating patients on adaptive strategies and community resources. Real-life case studies will be presented to illustrate effective nursing management strategies, shedding light on challenges and successful outcomes in the care of patients with OI. Looking ahead, ongoing research in OI care offers potential advancements, and nursing professionals are encouraged to stay informed and advocate for patients. In conclusion, nursing students are urged to approach OI care with empathy and a commitment to continuous learning. The presentation concludes with an invitation for questions and discussions from nursing students to deepen their understanding of nursing management in osteogenesis imperfecta.